as bad as the situation is here on the West Coast, other states with normally super high social trust and lots of civic engagement now have decided to follow the same ruinous path. States like Maine seem all too happy to throw away their cute little colonial architecture and small town boutique aesthetic and instead start the devolution into LA, Portland, Chicago, or New York. This now includes taxpayer-funded public health experts in the state teaching people safe tips, they say, for using fentanyl by injecting it, I'll politely say, up their backside. It's just something you'll have to see and hear to believe. Watch.
So when we're talking about that in the rectum, like not to, if there's a significant amount of blood, then something's going on, right? If we
right, absolutely.
There might be some blood because that area is so flush with blood vessels. So if it's the first time we're trying it, then some of them might kind of pop.
Absolutely, yeah. And right, and it's just kind of the same with like snorting. You might see a little bit of blood, and a little bit's okay, but a lot is concerning. I'd say it's kind of the same basic, anything that's not stopping, or seems to be getting worse is going to be an issue. If you have just like one little bit of blood and then it kind of tapers off, like that's fine. Or if it's just tiny little specks of blood, that's fine. Ideally, not having any bleeding is going to be better and have the least risk of infection, but don't freak out if there's just like a little bit of blood.
Ladies and gentlemen, your public health experts. Joining us now to discuss is Steve Robinson, the editor-in-chief of the Maine Wire. Steve, thanks for being back tonight.
Hey, thanks for having me.
Great. So you guys have a whole write-up about this over at the Maine Wire. Can you explain for us what in the world did we just watch exactly?
What you just watched was taxpayer-funded public health experts from Maine Access Points, which is a nonprofit here in the state of Maine, explaining to their customers, their clients, or anyone who's just curious about drug use culture, how you could administer fentanyl, meth, or heroin if your arms and your toes are too scabbed over and needle tracked for you to be able to successfully use intravenous drugs in the manner you're accustomed to. What they're talking about is boofing is the phrase for it, or booty dumping. And this is where you mix your drugs with a saline solution and squirt it into your rectum. And we received a tip about this at the beginning of the week, and I really didn't believe it. But we had one of our reporters go to a separate facility managed by the city of Portland, which is Maine's largest city. And in about 15 minutes, he was able to obtain a free boofing kit that came with 2 needleless syringes, several packets of lube, some antiseptic wipes, and just as a bonus, they threw in 2 free doses of Narcan and some fentanyl testing strips. This organization also manages our needle distribution or syringe distribution programs. In 2020, at the start of the pandemic, they decided that the needle exchange programs were going to drop the requirement that you bring in used needles in order to receive clean needles. So what we effectively have, they still call them needle exchanges, but throughout the state of Maine, in all our major cities, we have needle distribution centers. And the city of Portland has been tracking the number of needles they give out against the number of needles that they take in. And there's, in some cases, it's 100,000 needle difference. So the streets of our cities are littered with needles that could potentially harm a non-drug user, transmit infectious diseases. And it's ironic that this entire program is being done to mitigate the spread of infectious diseases like hepatitis or AIDS, but we're now littering our streets with needles that could in fact spread those diseases.
You know, and it reminds me in New York, same thing. It was one of those situations where you think that can't be real, but then it was real. In the subways, remember, there were those posters that were being put up saying to not be ashamed and not to feel stigmatized for using drugs, especially using fentanyl, to feel empowered. And they always do the little tagline of use safely, as if that's even real, as if that's even a true possibility. We remember early on in the Biden administration, those crack kits that they told us were not real, but then they were real. And back and forth we go with this crazy train. Now, I know these public health officials, they would, listen to what you just had to say, but they'll go, no, we're saving lives. People are going to use anyway. We're just trying to help them do it safer.